These are 5 questions that you can ask to help ensure safer and more appropriate antibiotic use. My name is Dr. Timothy Gauthier. I am the Antimicrobial Stewardship Clinical Program Manager for Baptist Health South Florida. Essentially, that means I'm a pharmacist with advanced training in the areas of infectious diseases and antibiotics. So what question should you ask? You're gonna get an antibiotic or considering one. Number 1 is, what infection do I have? Let the diagnosis guide the treatment. So sometimes we have infections that require antibiotics, sometimes we have infections that don't require antibiotics, but knowing what infection you have and what pathogens can cause that infection is really the key. That collaboration between the patient and the provider in order to establish a diagnosis is really important. Number 2, what are my non-antibiotic options? Antibiotics, yeah, they can be part of the question, but what can you do for symptomatic therapy relief? What could you do in terms of over-the-counter medications? What is safe for you? These are some important questions to ask as well. And then, do I really need antibiotics for this? Sometimes antibiotics are black and white, you have to take them. Other times it can be a judgment call. So if you are in the situation where it's a judgment call, maybe you do want to try symptomatic therapy first and defer the antibiotics, or maybe you need to go right to the antibiotics, but you can have that conversation. Number 4, what are the risks associated with this drug? So if I have an antibiotic I have to take, what are side effects that might occur? Being aware of the side effects can help you address those issues if they do come up. Hopefully they don't come up, but it's better to be aware so you can jump on top of it and take care of it than kind of find out in the process. So understand the risks. And then lastly, how long should I take these antibiotics for? We know that in practice, patients often feel better and they stop taking their antibiotics. That's not always a great idea because you may not completely treat the infection even though you may feel better. Also, sometimes it is okay to stop the antibiotic. So my advice is to talk to your provider before stopping your antibiotic early, and that's a really important thing. Make sure you communicate with your provider. I hope you have safe and appropriate antibiotic use. I hope these 5 questions help, and I wish you a wonderful day.